As COVID booster shots continue to roll out, we know you have questions. Who's eligible? Is the shot safe? And is it an option to mix and match with different vaccines? Well, our Verify team is here with the answers.
Is there an FDA authorization for boosters? Can you mix and match booster shots? And can you get a COVID-19 vaccine booster shot and the flu shot at the same time? These are just some of the questions about booster shots that we answered this week on Verify, so let's get you caught up. In August, U.S. health officials recommended that all fully vaccinated people should get a booster shot at least 8 months after they receive their second dose of a vaccine. With over 55% of Americans fully vaccinated against COVID-19, according to CDC data, many people are wondering if any booster shots have been authorized by the FDA. So let's verify. We went to these sources for an answer. On September 22nd, the FDA authorized a single booster dose of the Pfizer BioNTech COVID-19 vaccine for certain high-risk Americans. They said the booster shot should be given 6 months after the second dose. This authorization includes people over 65 years of age, adults with high-risk health conditions, residents of long-term care facilities, and adults who have jobs that put them at risk for exposure to the coronavirus, like teachers and healthcare workers. CDC Director Rochelle Walensky also recommended the booster shot for high-risk Americans. So we can verify, yes, the FDA has authorized the Pfizer COVID-19 vaccine booster shots for high-risk Americans. Next up, if a person received Johnson & Johnson's single-dose COVID-19 vaccine, should they get a booster shot of Pfizer? We went to these sources for an answer. The CDC says no, because there isn't enough data. According to the FDA and the CDC, individuals who received Moderna or Johnson & Johnson vaccines are not currently recommended to get a booster shot. So the short answer is no. But according to new data from J&J, their booster shot is highly effective at increasing antibody levels. But that data still needs to be reviewed by the FDA and the CDC. In the meantime, Dr. Amesh Adalja, a senior scholar at the Johns Hopkins University Center for Health Security, says people should avoid mixing and matching vaccines. So we can verify, no. It is not currently recommended for a person who received Johnson & Johnson's single-dose COVID-19 vaccine to get a booster shot of the Pfizer vaccine. Next up, can you get a COVID-19 vaccine booster shot and the flu shot at the same time? We went to these sources to verify. According to the CDC, a person can get a COVID-19 vaccine and other vaccines, like the seasonal flu shot, during the same visit to the doctor or pharmacy. The Public Health Agency also says on its website that people no longer need to wait 14 days between vaccinations as it previously recommended. Dr. Anna Durbin, a professor of international health at Johns Hopkins Bloomberg School of Public Health, told Verify that participants in last year's COVID-19 vaccine trials were allowed to get their flu shots and they had no impact on the results.
I'm very convinced that it's very safe to give these vaccines either at the same time or within days of one another.
So we can verify, yes, you can get a COVID-19 vaccine booster shot and the flu shot at the same time. We fact-checked even more claims for you this week, and you can find those stories and more at verifythis.com and on our social media pages at verifythis. I'm Marianne Till with your weekly roundup from Verify.
And do you have something you want verified? Email verify@12newsnow.com.